Meet Eve and her mother, Vera. Vera is still feisty at age 81, living in the same community she grew up in. She's also a die-hard Pittsburgh sports fan. Nowadays, however, Vera usually watches Sunday Steeler games from her home and manages various medical conditions, including COPD and heart disease. She's not feeling so well today, and Eve is preparing to take her mother to the doctor. Before her appointment, Vera uses an in-home spirometer that automatically sends results to her PCP. Her doctor also has data from other trackables, including a heart rate monitor and pedometer, which show that she has been taking labored breaths and tentative steps recently. All of Vera's data is automatically analyzed by a Watson-like AI decision support tool at the primary care practice. When Eve and Vera arrive at the hospital, they use the MapWise app to take the most efficient route to the doctor's office. They know Vera will see the doctor on time thanks to a no-wait-like app that removes uncertainty over appointment times. Chairs, doorknobs, toilets, sinks, all are automatically sanitized, and the air quality is continuously monitored. Dr. Haas greets Vera and Eve with a fist bump. It transfers less germs than a handshake, and he powers up Watson, which analyzes Vera's data. Freed from his role as a scribe, Dr. Haas can focus on relationship building and understanding Vera's motivations and care goals. It turns out he's kind of a softie. Watson has some bad news. Vera's weight has spiked over the past few days, and her heart isn't pumping blood efficiently to the rest of her body. Watson thinks there's a 98% chance that Vera has a heart valve problem and recommends that she has a heart valve replacement. Vera, Eve, and Dr. Haas agree that the procedure is the best option. With cost calculators and transparency tools, Vera knows exactly what the surgery will cost and what her insurance will cover. Vera's replacement heart valve is created with a 3D printer, and she's prepped for surgery. The surgeon's in his workout clothes, but that's okay because he's working from home on a robotic arm. The surgery, now minimally invasive, goes smoothly, and Vera is transported to a specialized ICU. With her own stem cells promoting healing, Vera is almost ready for discharge. But first, she gets a customized care plan from Watson, created based on her goals of care conversations with her various providers, her genetic biomarkers, and best practices in heart care from around the world. With payment reform, Dr. Haas and his team get paid for keeping Vera healthy in the community and out of the hospital. An on-staff tech expert shows Vera and Eve how to use Pill Drill, an app that notifies patients when they are due to take a medication dose and sends real-time updates to caregivers and providers. They schedule follow-up appointments, carried out via teleconference. Eve takes Vera back to her home and reluctantly leaves the fiercely independent lady alone. But she's not really alone. With great Call's suite of caregiver technology, Vera maintains her independence while Eve receives notifications related to her mother's vitals, diet, and other activities of daily living. The next morning, Eve receives a notification from Vera. Come quick. She dashes to Vera's home and finds her decked out in black and gold colors. It's time for the Steelers' victory parade, and Vera's not gonna miss it. Even in the future, some things you just have to see in person.